Somewhere along the way, humans decided that when you're seriously sick, you don't just stay home. You go somewhere built for it. That idea took a surprisingly long time to catch on. For most of ancient history, if you got sick, you were treated by family, by a private physician, or you traveled to a temple and hoped for help. In ancient Greece, people visited sites dedicated to the god Asclepius, called Asclepieia. Priests guided healing rituals and sometimes observed symptoms and offered remedies alongside them. It wasn't medicine, the way we'd recognize it today. But it wasn't purely superstition either. Call it something in between. A healing center, not a hospital. Rome built something closer to an actual hospital, the valetudinarium, with wards and dedicated staff. But it existed to treat soldiers and enslaved workers, and ordinary citizens mostly couldn't use it. Then, in the 4th century, a bishop named Basil built a large complex outside the city of Caesarea. It included housing, a hospice, and a ward for people with leprosy. And he opened it to anyone who needed it, free of charge. Historians don't all agree it was the very first hospital, but it's one of the earliest we have strong evidence for. And it looked a lot closer to a real institution than anything before it. A few centuries later, hospitals in the Islamic world, called bimaristans, pushed the idea further. Physicians in Baghdad and Cairo sorted patients by illness, trained new doctors on site, and kept detailed case records. It was some of the earliest medical education built directly around patient care. Medieval Europe, meanwhile, mostly stepped back from that. Hospitals there were built for shelter and charity, for the poor, for pilgrims, for the sick. Treatment was more of an afterthought. The real shift came later, in Paris, after the French Revolution. Control of hospitals moved away from the church, and physicians took on a much larger role. Hospitals slowly became places built around clinical observation and medical training. Then came the 19th century. Not one invention, but several arriving together. Anesthesia, antiseptics, and the discovery that germs, not bad air, caused disease. Add Florence Nightingale's push for sanitation and nursing reform, and hospitals became places built for treatment, not just shelter. And the word itself? Hospital comes from the Latin hospes, meaning guest. Long before it meant medicine, it meant something simpler: taking someone in.